Today we'll be using the antibiotic cefazolin for my patient who has pneumonia. It inhibits bacterial cell wall synthesis. It is used in infections in the respiratory, skin, soft tissue, bone, joints, and GI tracts. The safe dose ranges are 250 to 500 milligrams IV every 8 hours for mild infections. The adverse effects are anaphylaxis and diarrhea. And for nursing considerations, you should monitor the patient for diarrhea. Routinely check their IV site for infiltration. I'm going to begin by verifying the orders on the MAR, checking for appropriateness, and clarifying any inconsistencies. I'm also going to check for any allergies. Wash my hands, go to the med cart, take out the medications I need. I need the antibiotic, normal saline, and a bag of sodium chloride. I'm going to do my second check by comparing the dose and the medication to the MAR. I'm also going to check for expiration dates on everything. Okay, everything's good. Open up my medications. And then this one I'm going to clean with an alcohol swab because it's already been opened. Take my syringe. I'm going to take up 5 of air. Put it in my normal saline. And then take out 5 cc's. I'm going to inject those 5 cc's. To my powder. Recap my needle until I need it again. And I'm going to agitate this until all the powder's dissolved. Okay. Now that my medication is mixed up, I'm going to take my syringe, pull up 5 of air, push the air in, and then take out 5, the medication. Close my needle, and take my sodium chloride bag, and since it came out of the bag, I don't need to clean this. I'm going to check that in there, cap my needle, and throw it in the sharps. I'm gonna swish this around until it's distributed. I'm going to put a label on it. On the label is the medication I'm giving, the dosage, the date and time, my initials, and a patient label. So I'm gonna stick this on, and then I'm going to head to the patient's room. Before I came into the patient's room, I verified the primary IV order and the IV piggyback order against the MAR. I checked for appropriateness and clarified any inconsistencies, and I also checked the patient's chart for their allergies. I have all my supplies here. I'm gonna wash my hands, and I'm going to compare the IV piggyback med to the MAR for my second check. And I also checked the compatibility with the already primary infusing medication, which is running at 25 mLs per hour. The tubing on the primary line is only 24 hours old, so it's okay to use. Wash my hands again. I'm gonna ask the patient for their name, date of birth, and allergies. I'm going to tell them they're getting an IV infusion of cefazolin because they have pneumonia. And I'm going to scan the medication and compare names on the label to the patient's chart to make sure I have the right medication. This is my third check. I'm going to take my new tubing. I'm going to hang my primary line lower. I'm going to make sure that is clamped. Open that up. Spike the bag. I'm going to hang the secondary medication. Actually, before I hang it, I'm going to wipe off this. I'm going to open the clamp and back prime my piggyback. Okay. Hang that. Now I'm going to add the secondary cefazolin. Burning for an hour. All my clamps are open. And before I ran this, I would have assessed the IV site for any swelling, redness, or infiltration. And now while it's running, I'm going to ask the patient if they feel any burning or any discomfort. I see it's running properly. I'm going to give the patient their call light, tell them we'll be back in half an hour, and I'm going to go document the administration of the medication, the tolerance of the patient, and the IV site.